Well, I went in to see my doctor, and he gave me he called me back with the results of my MRI, and he told me that he could get me in for emergency surgery the following day, and and then I was really confused because I couldn't believe that at 29 years old, I needed an emergency surgery on my back, and I was actually really frightened at the thought of having back surgery. But yeah, his first reaction was emergency back surgery the following day after seeing the MRI. Before starting the treatment, I remember coming into this office and laying on the ground because I couldn't stand for more than about 30 seconds without having excruciating pain down the back of my left leg, and wherever I was, I would just have to lay down immediately, for however long it took to get the pain to relinquish a little bit. Then I could hobble to another 30 feet and then lay down again. So it was very intense.
To that?
My response to that was I called my family doctor back in Vancouver, British Columbia, and he advised me that the last thing that you would want to do is have back surgery, especially since there's about I found out there's a 30% success rate with back surgery. So he advised me to seek other other avenues, and basically just time. He said he was adamant about the last thing you want to have is back surgery, and I felt the same way, but I didn't really know what other options there were. So I started to do some investigation, and that led me to the Spinal Relief Clinic. Before when I first walked in here, every aspect of my life was affected. Every waking moment, it was impacting everything that I did. And as far as my activities now, I'm doing everything that I was doing prior to having that injury. I'm a little bit more cautious and obviously conscious of my back, but it's not the center of my of my day like it was for the first couple of months after it happened.
Everything.
Well, when I first came in, I was skeptical because I was in so much pain. I couldn't see how anything but a surgery could take care of something like that, and I just it was I was skeptical. And after my first treatment, I was still a little bit skeptical because I was thinking, well, how is this going to, I could see maybe getting back a small percentage and still having some sort of a limp or something like that, but after my first session I was skeptical that I could ever get back to anywhere close to not having pain, having full mobility. So I was a little bit skeptical for sure. The treatment itself is actually relaxing and fairly enjoyable. I actually look forward to my visits coming to the clinic every day for an hour or however long I was here. And the treatment itself is just a steady, incremental, progression, getting better and better. I hit a couple plateaus where for a couple weeks it didn't seem like I was getting any better, and then I would break through those plateaus, and like I said, I went from the first time crawling in the door to the last time I'm here, I'm walking out the door. So it's good.